Autoimmune psoriasis is a chronic skin disease that results from an abnormality in the body's immune system that causes T cells to harm skin cells. It affects 2% of Caucasians and is categorized by the formation of thick, scaly plaques on the body that are uncomfortable to have because of their dryness and cracking, as well as their appearance. It is treated with autoimmune suppressive drugs that inhibit the production of T cells in the body. Unfortunately, these drugs can only temporarily clear away the skin plaques, and the disease lasts for life and has no cure. Although the disease is lifelong, there are two periods in the patient's life when they are most affected: during adolescence, in a period between 16 and 22 years of age, and at the beginning of elderly age, in a period between 57 and 60 years of age. The severity of the disease can vary from patient to patient, so it is measured using two tests: the Psoriasis Area and Severity Index, or PSAI, and the Dermatology Life Quality Index, or the DLQI. These tests are often used together to determine the severity of a particular case of psoriasis. The psoriasis is classified as mild when the PSAI and DLQI scores are less than 7, moderate when the PSAI score is 7 to 15 and the DLQI score is 5 to 15, and severe when the PSAI score is greater than 15. However, even if the PSAI and DLQI scores fall in the moderate range, psoriasis can still be classified as severe if difficult to treat sites are affected or when there is a significant psychosocial impact. Despite there being plenty known about autoimmune psoriasis, scientists are still not completely sure what causes the disease. However, studies have shown the cause of the disease to be primarily genetic. For example, genetic factors that increase one's risk of having the disease have been found on 9 chromosomal loci named PSORS1 through PSORS9. Additionally, certain genes involving the production of keratin, a protein found in the skin, hair, and nails, have been found in patients afflicted with psoriasis. More specifically, keratinocytes, the skin cells that produce keratin, overexpress type 2 keratin 6 and type 1 keratin 16 and 17. However, the genes for keratin 16 and 17 are particularly important because they code for keratin assembly and are located on chromosomes 12 and 17. Additionally, genes that encode antioxidant enzymes like catalase, superoxide dismutase, and glutathione reductase have been shown to be downregulated in psoriatic skin cells, and genes IL-1B, CASP1, IL-36G, STAT3, and IL-37 were found to be related to the cytokines that trigger the immune response that causes psoriasis. In conclusion, autoimmune psoriasis is a disease where the body's immune system causes painful, scaly plaques to form on the skin. It cannot be cured, but it can be treated with autoimmune suppressive drugs, and the cause is shown to be mostly hereditary. Overall, psoriasis is a fascinating and mysterious disease that hopefully more can be discovered about in the future so that nobody has to suffer through it.